Great stuff. Well, a very warm welcome to all of you joining us. We've got expectations of around 170 registered for this afternoon's webinar, so decent numbers turning out. I'll do a little bit of preamble whilst everyone's trying to navigate their way through the lobby. So yes, very warm welcome everybody. If anyone doesn't know who I am, Dan Campsall. I am the chairman of Agilicis and also the vice chair of the Parliamentary Advisory Council for Transport Safety. And very warm welcome to this afternoon's webinar hosted on behalf of Road Safety GB, an opportunity to look at basically some priorities for road safety over the coming years. And 2 weeks ago or so, in fact, 2 weeks ago tomorrow, the Department for Transport released the latest provisional data, the data for 2023. Now, this happened after Parliament had been prorogued, so there haven't been any sort of official statements relating to it from ministers or from officials at the Department for Transport. So you're going to get an opportunity to have a little bit of a dig into that data with us today. And I'm delighted to say that I'm joined by an esteemed panel. In a few minutes time, you're going to get to hear a little bit of a presentation on what the data is telling us from Richard Owen, who is Chief Exec at Agilicis, and Will Cubbin, who, as well as working for Safer Highways in Essex, is also the Director of Research for Road Safety GB. And then we're going to go into a panel discussion where we're going to be joined by Ian Greenwood, Ruth Purdie, Lucy Straker, and Liz Box. So it's 3 weeks tomorrow until the UK will go to the polls and we will select a new government. And I only realised a little earlier today that we had gone through the entirety of the last Parliament without a major statement on road safety. So we selected the government in December of 2019, and we made it all of this way with the threat that a strategic framework for road safety would be just around the corner, but we didn't ever get it before we ended the Parliament and we go to the polls again in a few weeks' time. We've also passed a major milestone in the last few weeks as well, that we have now reached that point where around 500,000 road deaths have been recorded on British roads since records began back in 1926. And we're still in a place where 30,000 people a year are being killed or seriously injured on UK's roads. And the cost of that trauma is running at well in excess of £40 billion a year to the economy. So this is a time when, as politicians are thinking about the future manifesto, the manifestos they're launching in this week, which is Manifesto Week, and a programme for government, we want them to be giving consideration to those things. So a significant part of the discussion that we will move into will be around the calls for that future government and the things that they could be doing to address road safety across the country. But as I said, we're going to set all of this in a context of what the data is telling us, the latest data released in the last couple of weeks. So I'm going to hand over to Richard and Will to kick us off and introduce the data, and then bring the rest of the panel back for us to dive in with a detailed discussion. So Richard and Will, over to you.
Thank you very much for the introduction, Dan. So yeah, Will and I have been having a look at the data over the last nearly 2 weeks since it came out, and we're going to do a bit of a run through of the information that's in there. So I'm going to start off talking a little bit about the information. Let's just put through this and show what has been published, what will be published at some point in the future, what the caveats are, and then just highlight what the DFT pulled out in terms of the key figures. Then Will's going to go through in a bit more detail his interpretation of what the trends show. We've also done a bit of a benchmarking exercise, looking at what it looked like 10 years ago versus now, and then think about what progress looks like that we've achieved so far, and then also maybe a bit of a think about 2030 and what we'd need to do to achieve that goal of reducing casualties by 50% by 2030, which is of course a UN goal. We are members of the UN. We've signed up to that, even if we don't have official road safety targets here. We've definitely signed up to that one by proxy. We will also rely a little bit on some of the issues associated with the data and what you can't quite tell now, or what you probably need to have a little bit more information at some point in the future to be able to understand. So there's the trend line. That's chart number 1 at the top of the reported road casualties Great Britain. So you can see what the trend line is there. I'm sure if you squint a little bit, you can see that there's been a little bit of a downward trend there. Obviously, you can see the impact of COVID lockdowns. Now, it's important to notice the title on this. This is KSI adjusted casualties. Now, we've run webinars in the past through Joining the Dots and Agilysys on what the word adjusted means. This is to make sure that we equalize between police forces that are using different kinds of recording systems. So that means that it's reliable and comparable over time. The DFT have looked at 2013 to 2023. So they published a whole bunch of tables, which we've used in some of the analysis there. They traditionally do a comparison year on year, so that there was actually a 4% decline in casualties compared to 2022. In terms of KSI casualties, little change compared to the previous year, and then of all severities, down by about 3%, and we'll talk about what that might mean later on. They pulled out some interesting trends, again, just based on an individual year, and I'd always say beware sample size here. So yeah, they said that fatalities from motorcyclists showed a decline of 12%, which is to be welcomed, but is that within the normal range of variation that you'd expect to see for any of those groups? When they looked at the biggest percentage change for all casualties, they found that was pedal cycles. So that's a much bigger sample size, and that was a decline of around 6%. And then interestingly noted at the bottom that 75% of fatalities and 61% of casualties of all severity were male. Now, you may look at this and think this is pointing out that men are worse drivers, which of course I wouldn't agree with at all. But remember that men do tend to drive more miles than women as well. And this underlies some of the problems we have with reporting. We need to understand the rates that sit behind it. Also highlighting that men are more likely to be fatally injured as well, which is an interesting one and not something that I'd particularly picked up on the past as well. Right. What is included in the release? It's provisional data. Not all police forces submitted full records. You can see a list of those police forces that didn't submit full records on the DFT's website if you wanted to. This means that crucially, DFT imputed the missing values. So this means created the values based on previous trends. So that means that they added in some numbers that aren't true, and we will find out whether they are true when the final data comes through, which isn't going to be available until September. So the DFT, as I understand, are finalizing the data ready for that publication, but it's still not there yet. They only publish a really limited number of data tables. You can only do so much with the data. There's no record level information there. You can only analyze specific road user groups. Some of the age-based analysis that they've done doesn't align with the typical age groups that we want to analyze. They included young drivers up to the age of 29, whereas typically we want to look up to 24. We're going to have to wait for those. The good news is that they have included some casualty rate data because we do have traffic information. They didn't have that last year when they published the information. What I would say as well, if you look around the internet, you will find that some police forces and areas have chosen to publish more data. There's a really good example of this that came out last week when the Welsh government provided quarterly analysis and broke it down by road speed limit, particularly keen to illustrate what change might have happened following the introduction of their widespread 20-mile-per-hour limits, which is very positive in terms of casualty reduction. It's almost like we have some really good evidence now to show that reducing traffic speeds has some kind of impact. We might talk about that one a little bit later on. So I'm just going to hand over to Will now to go through some of the individual user trends that he's been having a look at.
Thank you, Richard. Yes, I'm going to look in a little bit more detail at my impressions I got from the tables that DFT chose to highlight and publish on the publication on data.gov. This isn't by any means a deep dive into the data. So first of all, there is a breakdown of different severities of the data that Richard showed earlier, with that fourth graph showing all motor traffic billion vehicle miles. So again, it helps us understand a bit about rates, although ideally we'd perform more of a calculation with the raw data to understand the rates in more detail. The thing that really jumps out there is the impact of lockdown. There's that downtick in all the graphs that coincides with lockdown, with fewer traffic miles. It's established that there is a relationship between the amount of traffic on the roads and the number of casualties recorded. However, on closer inspection, if we look over the 10-year period, the 11-year period, especially the bottom two graphs, the total casualties on that downward trend, whilst the trend for almost traffic is an upward one. The graph is somewhat the same shape, but it's tilted upwards. Same with KSI. KSI is on that slight downward trend, less so than total casualties. Fatalities is more flat, but when you do look at the numbers in detail, they are very slightly down on what they were 11 years ago. So that tells us that the relationship between traffic and casualties isn't a simple one. It certainly influences the number of casualties. More traffic increases exposure, the number of chances there are to be in a collision, but high levels of traffic can create congestion which suppress traffic speed. So there may be a point where high levels of traffic can actually be of safety benefit. There's other drawbacks to high levels of traffic, of course, particularly around air pollution. But when we're trying to understand our casualty statistics, there may be an impact of that. It's also important to understand that traffic volumes don't have a direct relationship to congestion, because it depends when that traffic is distributed throughout the day. If it's more evenly distributed, then the resulting congestion is less than if it's concentrated around certain times. The other thing that really jumps out looking at these graphs is that difference really between fatalities and total casualties. Fatalities quite a flat trend, total casualties showing a downward trend. So we have to consider the possibility of increases in under recording. We know that Stats 19 always has been a sample. It's what's reported to police. So we have we know there's under reporting rates, but it's important to note, have those under reporting rates increased? If we look at pedestrians in a bit of detail, we can see they've had a 2% increase in fatality rates, but a 20% drop in all severity rates. So that begs the question, if there hasn't been under reporting, has there been something that has increased the survival rate of pedestrians, which is certainly a plausible explanation. Improvements in post-collision response and care may explain that difference, but it certainly requires a deeper dive to really understand if there has been a change in under recording. If we move to the next slide, please. And yes, the graph should populate. There is also a change. I think if you click on one more, there should be some figures in change. So yeah, this is looking at a shorter baseline period, a 3-year period, 2014 to 16. That helps us avoid that looking at a change over a 1-year period, which can have pitfalls in percentage changes. That does show an encouraging picture of most vehicle groups showing a reduction in KSI casualties, not as big as we'd like to see. The one that jumps out there is other vehicle. It's other than bus and coach occupants, it's the smallest group by number, but it's had a large percentage increase. There has obviously been changes in types of vehicle used, the advent of the popularity of e-scooters, for example. Also, without looking into this data in a bit more detail, I'm not 100% certain where vans under 3.5 tons sit within this classification. I believe they do not sit within the goods vehicle classification, and if that's the case, then increases in things like delivery drivers and an exposure number of miles driven by vans would also contribute to a higher exposure for other vehicle occupants, which might contribute towards that increased trend. Okay, moving on to the next slide, please. If we focus a bit on cycling, because cycling is fun and interesting, comparing fatalities with all casualties for 1 year, there was a drop. There was also a drop in the volume of miles cycled, a small drop in percentage. That still appears to be a correction from the boom in cycling that was seen during lockdown periods, with rates returning to roughly what they were in 2019. If we click on one more with this, now comparing to 2013, that much longer period, this is where it gets quite interesting, because again, we've seen similar levels of reduction in fatalities and all casualties for cyclists over a period when the exposure, the number of miles travelled by a bicycle, increased by 15%. So that begs some interesting questions. It points towards the safety in numbers effect, where increased amount of riding exposes motorists to more cyclists. They're more used to and accepting of cyclists, and more likely to be a cyclist themselves or no one. It's reflected every time that data is looked at. It also somewhat contradicts the idea about under-recording. If fatalities and casualties and all casualties have changed by about the same amount, fatalities are much less likely to be under-recorded than slights. If they've changed by roughly the same amount, then either that supports the idea there hasn't been a big change in under-recording, or there's been an offset of that difference in that there's been an increase in slights that has then gone undetected and offset the under-recording. What's happened when you look at other data in relation to cycling is cycling has got a bit faster. So for the more enthusiast rider, the technology has improved, focused on aerodynamics. For the enthusiast rider has increased average speed recorded on Strava. For the sort of the novice rider, or there is an increase in use of smart trainers and apps that allow people to gain fitness and power in their homes. So they're taking that faster speed out onto the roads with less experience. And then for newcomers to cycling, the advent of e-bikes, where people can access higher speeds without at lower experience levels. So they would all point to actually higher risks. However, worth noting when looking at cyclist casualties is the share of contributory factors between cyclists and motorists involved in those collisions points to motorists having a much bigger influence over outcomes for cyclist risk than the cyclists themselves. So again, lots of interesting questions raised by the data that is worth looking into. And if you move on to the next slide, please. This is the last area to focus on, breakdowns of age and sex, male and female, different age groups. There's been a closing of the gap between young drivers and middle-aged drivers. They are still the highest risk group once you take into consideration the number of miles travelled by that younger age group, but they've closed the gap, and that begs some questions as to why. The data doesn't answer that. Again, it prompts us some interesting questions to look into. Have vehicle safety improvements been of more benefit to the specific risks that young drivers are more likely exposed themselves to. The impact of telematics insurance policies may have had an impact. Has the cost of motoring kept young drivers on public transport for longer, and has that benefited their safety? Has socialising over the internet reduced the number of journeys, particularly the risky late night ones that they engage in? Has it reduced that? And have improvements in young driver education had an impact as well? Not all questions we can easily answer, but potential explanations for why that gap has closed. And even though the gap has narrowed, they are still the highest risk group. And that information supports calls for graduated driver licensing, which we will discuss later on. So I'll hand back to Richard to round up for us. Thank you.
Thank you very much, Will. So in terms of our performance, we've had a look at some numbers there, and you can have a look at the trend lines and discuss whether you think 11%, 12% reduction is good or bad, etc. I think it's possibly worth reflecting on the 40% reduction that we had in KSA casualties between 2000 and 2010. So if you want to put them into perspective, that's perhaps where we've missed out. And that's what this chart is showing here. So a few years ago, together with PACT and the Towards Zero Foundation, we worked on a project to have a look at the performance of GB road safety. And what we did is we created this chart here that showed two lines. So you've got the black line there, which is the actual performance. So the total number of people killed or seriously injured in Great Britain between 2005 and 2019, as it was then. And what we did is we looked at an inflection point around 2010, which is what most people agree tended to be the point where those previous casualty reductions really stalled. So what we did is did some statistical analysis on it, and then worked out, what would have happened if that 5-year trend line had carried on. And that's what that yellow line is there. So that's showing that forecasted trend line using statistical software. And then we worked out that that equaled almost 40,000 deaths and serious injuries that had happened that might not have happened if we'd managed to keep on the same trend line. Now, there's lots ifs and buts about what has caused that, but I think that does put it into perspective, the real opportunity that we have to reduce death and injury on the roads, and of course the consequences for those other people that are affected by those incidents as well. When we also published that, we introduced this chart as well, which was comparing against a baseline that we introduced, and tried to look at what had happened around the country, which is what wouldn't be interesting to see if there was variance in performance. And we were quite surprised by the variance in performance because, I would have assumed that a lot of road safety casualty reductions are the result of changes in vehicle fleets, general changes in people's pattern of movements from around the country. And what we saw, there were some quite big differences. So some quite large increases. So Devon and Cornwall, you can see Norfolk, Lincolnshire showing increases in casualties there, but other areas, almost the whole of Scotland, for example, you can see part of the West Midlands in there that was seeing significant reductions. And at the time, we didn't propose any particular reason for this. But I think there is some information that we can use to try and dig a little bit deeper into this to try and understand why they might have happened. So we talked about what was included within this statistical release, and we talked about what isn't in there. The question is, can we compare performance between areas? Can we look at any regional trends, for example? You can look at urban or rural areas, for example. How would the impact of local priorities, the adoption of Vision Zero road safety partnerships have, the more widespread introduction of 20 miles an hour that we've seen across huge parts of the country? So the first answer is, sorry, you'll have to wait until September, but it is mostly. That's if you want to go into any detail, but there is some information that's published. Now, the problem that we do have is about that imputed data. So some of this isn't entirely true. So here's another chart that I spun up, which used that same 2014 to 2016 baseline, looked at those adjusted KSI casualties and compared it to the 2023. Now, looking at this, there's a whole bunch of road safety hero police forces. So if you look at that bottom end there, you've got a 42% reduction in South Wales, Staffordshire 38, Police Scotland 32, Thames Valley 31%. They seem to be performing a lot better. But then at the other end, you've got other police forces, Surrey, Gwent, Gloucestershire, that seem to be showing an increase in casualties. And that very large difference, even at that kind of scale, alarms me and makes me think that perhaps there's something else going on here. And it's something that Will hinted at earlier. It's about differences in reporting. Now, I'm not going to bore everybody on the details of the crash system, etc., and things like that, but there does seem to be a large divergence in the reporting levels of certainly slight casualties, but also into some serious casualties as well. And I think this is something that we need to spend more time looking at. If we want authorities to be able to benchmark their performance against other authorities around the country, compare themselves to national trend lines, we need to be really secure in the knowledge that there aren't local reporting changes that are influencing that. So I think this is definitely something that we, the sector, need to be keeping an eye on, and hopefully something that the DFT may turn their eye to at some point in the future. So what's coming in September? We get the verified data, none of this made up stuff. All of the official results will be available. You will be able to download all of the data tables, and that includes the individual records. So many of you are aware that data.gov.uk allows you to access that data. You can access it via all sorts of different tools. You can use the DFT's data download tool that's really handy if you want to do your own queries. I am contractually obliged to mention that, websites like CrashMap and MAST will be updated, which allows many people to do comparisons themselves. And it also provides links to other socio-demographic data, so we can look at things like, the impacts on deprivation. And of course, individual authorities and police forces publish their own dashboards. We've showcased a lot of those on these Joining the Dots webinars in the past. So yeah, definitely look towards Devon, Transport for London, Northeast, some really great examples of local forces examining that data. But isn't it a shame that we've got to wait? Isn't it a shame that we're in June now and having this discussion? Isn't it a real shame that we have to wait until the end of September to start to dig into the real details? Wouldn't it be great if we were a bit more like the French? They publish data already on their website for April. You can have a look. Okay, it's high level data about fatalities, accidents, injured people in there, but you can start to have a look at those trends and compare them. And actually, they published all of their data already. Their full report was out at the end of last month. And they do a lot of public data sharing as well. So I think it would be fantastic if, we had some form of repository of data. I mean, obviously the DFT they're actually really good at publishing data. There's a lot of open data that we do in this country that other countries don't. I'd love to see it in a more timely fashion. I'd love to see us being a little bit more like the French and just publishing some data. And that could definitely be achievable. The impact of the crash system has been really good. It's definitely speeded up reporting. Unfortunately, it's not adopted widely across all police forces, and that is a concern for many of us. It'd be great if everybody was just using the one system. And maybe that would enable all of us to get a better insight into what's happening, not necessarily on a live basis, but at least on a quarterly basis, so that we can react to anything that's happening in the world of road safety. And you can start to potentially even operationalize some of this data within road safety stakeholders and authorities that are looking to prevent death and serious injury on the roads. So that's the Geek Fest from me and Will, and I'm going to hand over back to Dan and the rest of the panel.
Great, thanks guys. Inevitably, you're not the only geeks in the country, so there are others who would like to engage in detailed discussions about particularly the titles on your charts and whether you've referenced them properly, etc. But let me just ask you a couple of questions that are perhaps at a slightly sort of higher level. The where you landed there, Rich, is talking about the timeliness of the data and the fact that we're only getting data now for what happened 6 months ago, and some of that data is incomplete. By the time the full data set lands, we're talking about data that's 9 months old. Is that delay in the data, how do you feel it is hampering us in efforts in road safety? And is there more that we could be doing to address that?
Ooh, I almost want to just push that straight over to Will as somebody who is involved in the operational use of that data. Obviously,
Feel free.
Not expecting you
Yep.
to comment on your own local situation, but as a practitioner, Will.
Yes, yeah, I'll try and keep it national level and rather than bore everything with Essex details. But yes, I've kind of worked in that area. My experience in looking at road safety trends is unless you have a lockdown, they don't tend to change suddenly. They evolve gradually over time. And accuracy is more important than timeliness in that respect. If you're looking at the big trends and your strategic approach to road safety. And that said, having valuing data and having good systems in place to record it are likely to achieve both aims of accuracy and timeliness. When we've had delays in data, when our timeliness has suffered, it's normally been related to a data quality issue, where things haven't been got right first time. Items have been missing, and someone's had to go back and look through notes or rack their brains about what happened 6 months ago in order to complete a file. So, although I think accuracy is more important than timeliness, the two, if you're doing it right, you should have both. But then if you're looking to operationalize the data, that's when you are looking to have timeliness as being important. So where you're, for example, using crash data to populate the police tasking dashboard, important to have that timely, but be sensitive to historic trends, especially seasonal trends. The classic one being the springtime power two-wheelers coming out. If you're looking over your last 6 months, you've not had many power two-wheeler collisions, so you're not going to be going to where they are. So you still have to be informed by a longer term pattern when you're looking at kind of operational reactions to data. But I think the important thing is having the systems and having the leadership that values data quality and allows it to be populated right first time, and then timeliness will follow.
Right, and there was actually, for anyone who was at Joining the Dots for the in-person roundtable discussion that we had a few months ago, you'll be aware that this was something that we did talk about at some length there, and it was great to have colleagues from Department for Transport talking about that challenge between sort of accuracy and timeliness, and there's always a tension between those things. One of the things, the other thing I wonder whether we just try and tease out a little bit more, because Adrian's asked a question about it in the Q&A. Please do continue to feed in your questions, everyone. We will try and get through some of them, but inevitably we won't be able to address all. This divergence between KSIs and other severities, and Amy has also asked about all of the unreported data as well. In what you presented, Will, around the pedestrian issue, indicating that pedestrian fatalities are rising, but other severities are being less well reported, or at least, they're dropping. That would seem to suggest a significant deprecation in reporting, because if the fatalities are rising, but we're not seeing other severities, like human survivability isn't changing that much. Have we got a major issue really on the reporting? Rich, that might be something that you want to address.
Yeah, I think Will pointed out what a lot of us have been observing for some time, and we don't have an answer on. There's definitely been a move towards more online reporting. How many members of the public are aware of that? How consistent that is between police forces, I'm not quite sure. We've certainly had a reduction in police numbers, a reduction in the number of dedicated traffic officers, which is less than ideal for a number of different reasons, of course. Maybe there's fewer trained police officers that are able to fill in the forms and they're prioritising them. I mean, I don't know the answer towards that. Making sure that we've got access to as much data as possible from different sources is important. We've always known there's been underreporting. DFT's always provided an estimate of the level of underreporting. Having links to data from hospital records and trauma centres, I think, would be really critical. It doesn't help us with those slight injuries, but it certainly helps us with the much more serious ones with the worst outcomes for people. And they're certainly the ones that we need to be thinking about prioritising. So, yeah, I don't think we're quite rid of slight data in there. I would love to see more of that put in there. Maybe if there's a slightly lower level of recording and reporting requirement to make it easier, possibly something to be considered in the next review of Stats 19 for sure.
I think that's a question we might come back to with Liz in a little bit when we're talking about road safety investigation branch and some of the stuff that comes in the manifesto. But let's segue nicely from, you've had your hors d'oeuvre or your starter. We're going to jump now into the main course, and I'm sure my guests will love to be referred to in that way. So let's just do some quick introductions of who we've got in the rest of the panel, and then we're going to go into some questions, not just about sort of the current context, but about what we could be and should be doing as we move forward. So let's introduce the rest of the panelists. Liz, I've already mentioned you. You do a quick introduction, say who you are.
Good afternoon, everybody. My name's Elizabeth Fox. I'm Research Director at the RAC Foundation.
Great stuff. Thank you. We're also joined by Lucy from Break.
Hi, thanks, Dan. Yeah, Lucy Straker here. I am the campaigns manager at Break, the road safety charity.
Fantastic, thank you. Ian, I can't see your camera switched on, but I presume you're there.
It is switched on. I'm sorry you can't see it. Hello, everybody.
Hey, there you are.
Ian Greenwood. I come with a number of different hats. I have a career in the health service. I used to run hospitals and various things. I did a PhD called The Politics of Road Death, so interest in road safety policy and the politics of that. I'm also a PACS trustee, and I campaign for stopping road death because my daughter died in a car crash in 2008.
Great, thanks, Ian. And last but by no means least, Ruth, over to you.
Good afternoon, everybody. I'm Ruth Purdie, and today the hat I wear is the CEO of the Road Safety Trust, who I'm very proud to represent, because I think we do, with colleagues who are actually here today on the screen and I'm sure listening, do some great work.
Great stuff. Thank you all. Great to have you all with us. And as I say, keep those questions coming in, everyone. We will try and get through as many as we can in the time that we've got remaining. So I said right at the top that we're going to take a look at the sort of what comes next, what could we be doing after having had a parliament where we had no strategic statement on road safety. We got close to getting a strategic framework, but unfortunately we didn't ever get anything over the line. Road safety organisations around the country have been kind of pulling together in the last few weeks and saying, actually, this needs to be a parliament in which that's addressed, where organisations come together with government to make a call and address some of those outstanding issues that are very clear and very present and very real on our road network. There has recently been the publication of a sort of manifesto for road safety, calling on governments of whatever flavour comes into power to do some things urgently to address road traffic injury. Ian, I wonder whether I could just go to you first as a fellow PACS trustee, just to explain what the asks within that manifesto for road safety are.
Well, there's a good test to start off with, Dan. So I guess the way this was developed was to raise the profile, get a collaboration, and to be really clear and precise in a small number of aims. So the 4 things that we came up with after a lot of debate and consultation with numerous people who were very helpful in pulling it together. Jamie and his team in PACS actually wrote the document with lots of help. Were 4 things. One, in the need for a strategy. You've referenced already, Dan, that we haven't had one. There are lots of strong views that the strategies, in inverted commas, through the 2010s probably weren't that effective anyway. They were more statement-based rather than strategic. So one is a strategy with targets. Secondly was a general safety requirements, which is missing, which I'm sure we'll talk about today. Thirdly is graduated driving licensing, or at least a focus on young driver risk. And lastly, a road safety investigation branch. And I did that without looking at any notes, so I'm really pleased with myself.
Well done. Ian did actually have to help me out at a conference recently where I got through the first three and standing on stage embarrassed myself ever so slightly because I couldn't remember the fourth, and so he came to my aid. So I knew he'd be a safe pair of hands to go to with that question. So one of those questions, which I think is a nice segue, is the idea of a road safety investigation branch. We've just been looking at some of those stats and what they indicate in terms of where our current performance is at. We talked a little bit about quality and timeliness of that data and whether it's improving or indeed deteriorating. So I wanted to ask sort of where we're at with this whole idea of a road safety investigation branch. What difference could it make? So Liz, if I can come to you first, because obviously RAC Foundation were really kind of key in creating something of an evidence base behind how an RSIB could and should work.
Yeah, absolutely, Dan. And I think I noted down when you were talking, well, actually, you were saying this is throwing up lots of interesting questions, the data, and it'd be useful to know more about it. And I noted in some of the chats, a number of the comments were, you know, we're making a lot of assumptions, we're having to pull a lot together. And I think where we are because we don't have that proper system in place that allows us to fully understand what's happening. We have to pull bits of research from here or data from here and make assumptions. And I think at the root of what the Road Safety Investigation Branch would do, and everybody on this call will understand that, is actually really get a thorough understanding of what's really happening out there, what the causal factors are, but beyond behaviour, thinking about the system, what we need to change in the system and getting evidence to do that. So at the RAC Foundation, we ran that road collision investigation project from 2017, 2018 for the 3 or 4 years that it ran. And it was really helpful to be able to get that kind of real evidence base together for what would it actually achieve. We had 3 different police forces, and they were going through forensic collision investigation files and using a systems thinking framework to look at those collisions and work out what were the multiple causal factors within that. And actually, there's multiple different papers that have been written and published in journals as a result, saying ultimately it comes back to the system, it comes back to legislation, it comes back to policy. And you know, I think we're getting better at it, aren't we? But I think traditionally we focus far too much on the sharp end, as it's called in systems thinking, on road user behaviours, and we know we need to do much more the other end. And I think that's really where PAC should be applauded with the manifesto, because if you see all the various different manifestos that are coming out from places at the moment, everybody has about 25 asks, and I don't know if any of them could explain it or be able to as you say, remember what they are. And these are very specific asks that are system focused, that will improve our safety system. And I haven't seen many other manifestos that are doing the same thing. Often people say we want a safe and sustainable system. Well, of course we do, but actually, how do you achieve that? And I think PAC's done a really good job actually getting to the nub of what are those 4 things that so many organisations can get behind and ask for. So I think that's a real positive thing, I think, for our sector.
Great, thanks. And that sort of safe system lens is very much going to be sort of a framing for the conversation that we have between now and 3:30. Ruth, I wonder whether I could just sort of come to you on that, because obviously the Road Safety Trust has been a key component of providing some of the evidence in the absence of there being a road safety investigation branch. I mean, is it a frustration to you that actually you'd love to be working sort of hand in glove with a public sector body that's providing that evidence? Do you feel like you've kind of been left doing what what has been absent? I mean, how do the Road Safety Trust see it and that call for an RSIB?
First of all, we support it because like PACs, they would be an ideal body to hold the government to account. And I think that's what's been missing. There's so many of us who are passionate, but that also works against us. Sometimes that, we're easy to push aside and we're disparate. So that's the real strength of the manifesto. By the way, I've come up with a mnemonic called GRAN. I'll send it you. It's the way I remember it because I keep getting asked questions on it. In the Road Safety Trust, I think you're right. We have to form collaborations really around advocacy and sharing of data. And we are really excited, perhaps for the first time, and I can't go into detail, but we're now starting to receive applications from organisations who are working with other partners and sharing data in a way that we've not seen before. And I'm really encouraged when I see criminal justice data and health data being shared so that we can understand the art of the possible and how those outcomes following evaluation can be shared nationally to show what can be done. But again, that is still parochial, it's not national. And my worry is that we're falling behind other countries who do within hours publish this data. Yes, it needs to be adjusted halfway through the year and at year end, but you know, countries like Lithuania are now looking at a 44-point national road safety plan. And years ago, Lithuania were looking for help and advice to prove their road safety, figures. So that's my worry, that we will fall behind. And one of the key ways of understanding what the problem is to share real-time data with the people who need it. But perhaps we need to start before that. And if I'm honest, I would like to see an evaluation of who holds what. And then we can understand what would be useful in sharing. And maybe we start like we have done with the manifesto. We identify a small number of really key data sets that we can share amongst ourselves, have that mandated. And if it's not mandated, maybe we need to form an alliance to make it happen. And I think that will help inform our understanding, and therefore we can take action.
Great, thanks, Ruth. I think there's a number of examples around of where data observatories have really been helpful to drive that. Liz, did you want to come back on that?
Yeah, just very quickly on the point that Ruth made there. So we published a piece of work at the RAC Foundation a couple of months ago by a PhD student at Imperial College, a surgeon who's been very much looking at joining different data sets together. And as you say, Ruth, that's absolutely critical. And, you know, we have started those discussions about how can you join up transport and health data, because it's madness at the moment that you've got medical practitioners that say, you know, we know what state people came in, but we have no idea where they were in the vehicle, what the mechanics of that actual injury were. And if we can get that data at a high level that can be joined, that can be agreed at sort of a government agency perspective, then you can have a sort of trusted research environment that people can work in. I think that will take us much further forward. So yeah, I just wanted to say, agree, very important.
Great, and other panelists wanting to come in and add weight to that as well. Richard, why don't you go first, and then I'll come to Ian. Yeah, but you're on mute.
Sorry. Yeah, I think it's worth recognising that there's been quite a lot of work done by the DFT in this area. About a year and a half ago, they published a really excellent report that was looking at linking health data. Now, for reasons beyond their control, that access to the data has disappeared, but I know that they're working really hard to make sure that it's put back together again, because they recognise the value in having access to that extra trauma data. So I think, you know, if the DFT are interested in working on this, yeah, let's keep pushing them.
Great stuff. And Ian.
You're going to get much more support from me as well with what Ruth and Liz have just said. But thinking about my NHS experience, yes, patient confidentiality is always a very real and very live and valid issue, but it's often used, I suspect, as a little bit of a smokescreen as to how difficult things are. There is a lot of health data, and I think one of the things I observe with my new role now is that health data is possibly more robust and more effective, but very difficult to access because of confidentiality. Whereas although stats data is available late, it is much more publicly available. It's the crossover that Liz talks about. But the other thing I would say is that a lot of the health data also has gaps. So if you look at pre-hospital data, for example, from when the emergency services are at the roadside, paramedics or emergency doctors or whoever, and then get into the hospital or into the trauma centre, that data is also very patchy. So I think it's important to recognise that there are still, even in the health side, which I think is probably more better, much more effective, there are still very significant gaps in the kind of the where and the what and the position, and where was the car, was it in a ditch, all that kind of stuff, and actually what happened to the patient.
Yeah, great. Thanks, Ian. And yeah, thanks, Liz, for posting the link to that. And you're welcome to take the name of Joining the Dots, you know, sort of in that title of that report. Lucy, I wonder if we can come with a question to you, which is, in fact, we've touched on it in a couple of points in the conversation already. At the global level, we've got this sort of these global drivers around road safety, the Stockholm Declaration, the UN General Assembly agreement around aiming for a reduction of 50% by 30 in fatal and serious injuries. We've heard about some of the local partnerships that are really kind of driving for reducing their own fatal and serious injury data, but it does seem like the middle bit we're missing is the national strategy. Why do you think that is missing from the national conversation, and what would Brake like to see sort of stepping into that void at the moment?
Well, yeah, it's a conversation we've had at Brake this week, actually. I've been as I'm sure most people on here have been very closely studying the manifestos that have been coming out, and just generally the noise of the policy areas, and also the debates that have been happening as well, the TV debates. And what we've noticed is that complete omission around road safety. You know, there's no questions being asked by the audience to, you know, the politicians or subsequent, the candidates are not being challenged around road safety. Yes, with this talk about active travel in a lot of the manifestos, and specifically in the Greens and the Liberal Democrats, but there's not really been that push around road safety. And it's almost, you know, we were asking ourselves why that is. Is that kind of like a feeling around the public that actually it's just something that we have to accept? And it's a conversation that we've had many times. I know Ian and I have had this conversation that a lot of people kind of just have this kind of ambivalence towards the roads. They have to use them, so they have to kind of you almost kind of accept that that's the level of it is. But what we kind of try and change is that theory is that actually we don't have to accept that 5 people die on our roads every day. We shouldn't accept it. We should be pushing back and saying, you know, there's a lot of all the things that are really high in people's manifestos that don't affect the same amount of people as are harmed on our roads. And why is that? And that's a question we've been pushing out, and a question that I've been looking at is kind of our response to the manifestos as well, is asking that question, why? And I don't have the answer yet, and it's something that we've been putting to candidates for the last few months. Yes, other things start to bubble up. People, the young drivers that graduated driving license, you know, if you look at the kind of this time last year, the kind of response from the media and from politicians was very, very negative, whereas like in less than 12 months that moved to being very positive from the media perspective. And again, it's asking that why, and I'd like to say we don't have the answer, but it's a question that we need to continually be pushing forward. And as like Ruth and Liz have said, you know, if we can get that alliance together, because I'm a big believer that we are greater together than we are kind of separate. So, you know, we would fully support that as well.
Great, thanks. Ian, I feel like I'd be remiss if I didn't come to you at this point, because obviously that's what your doctorate was looking at, was how is road safety sort of reported within the political environment? How much traction is it getting as a policy area? And I just wonder if you'd want to contribute in terms of how do we get it back onto the agenda and into the foreground for the parties?
So I'll probably add two things, Dan, specifically. One of which is I used a tool in my thesis, which is an American tool, and it talks about the policy problem, the policies and politics. And there's a lot of academic literature from decades that basically says if you can align those 3 streams, it's called the multiple streams model. If you can align those 3 streams, you are much more likely within a very complex, almost chaotic policy environment on which there are literally thousands of issues floating around. I talk about a policy soup, which I quite like. They literally float around in this policy soup. So how do politicians, through lobbying, through persuasion, through evidence, through the media, through data, through evidence, how do they pick out the piece from the soup, if you like? My analysis basically said there was 2 phases. Phase 1 was we had all those 3 aligned. between 1987 and 2002. And then from 2003 onwards, we didn't really have those aligned. Tony Blair got bored with it. Gordon Brown didn't bother. And then all the Conservatives, all the coalitions over that period of time didn't do any agenda setting of significance, which is why we've seen the data we're talking about. So that's kind of the framework that I would use and I try and advocate. And I can talk for hours, but I will resist doing that for obvious reasons. What I wanted to pull out, I think, today was framing. One of the big things within again, within the public policy literature, and it's kind of got a little bit of a bad name with Road Peace's Stop the Accident language campaign that they had. Quite a lot of people are quite cynical of that. So I would approach it in a different way, and I'd go back to the public policy literature. Over decades, if you have a policy image and a policy venue that match with language and with acceptable form of describing it, a policy problem, you are much more likely, if you can get that aligned, to have policy development. I'll give a really good example, which is smoking. Smoking policies from the 1950s started to talk about Hollywood stars, glamorous, sexy, all those words, all that language that went with that in terms of a very different framing. Professor Dahl did his work, and then over decades that obviously changed the language. Now the framing of how we talk about smoking and the incidence of smoking and the problems and consequences that are resulted from smoking is very, very different. I see lots of similarities between the chronology of what happened within smoking policy development with road death and road danger policy. And a lot of that is about language. If you look at the policy stuff that came out of the House of Commons and Department for Transport and the Transport Select Committee, and I will not be too much longer, Dan, that the language is really quite important. So a lot of language is best in the world, safest roads in the world. We're tirelessly working on this very kind of strong language. They've not really got a problem here. And again, if you look at the latest data that Richard and Will have taken us through today, again, there's hints of the language in there, all these drops and falls. And so basically back to my 3 Ps, I argue that we've not really identified road death as a policy problem, even though we've got possibly thousands of policies that are available. And the politics of this in the last, I would argue, the last 20 years has been much less visible, much less discourse. And if I just say one last thing, Dan, and I will shut up. One last thing is that in my first period, that I can't remember the numbers off the top of my head, but something like 8% of the major road safety policy debates, half-day, full, proper debates about different issues, about strategic road safety issues, were in the first period. In the second period, it went off a cliff, and we've not really, the House of Commons haven't really talked about it. And post-Brexit, post-COVID, it's even gone even further down. Sorry,
Yes.
that was quite long-winded.
No, that's fine. And to be fair, I would quite happily, this would be my geek out, would be talking with you about this stuff, because I think I recall that the first use of the language of war on the motorist actually came in about 2005, 2006. And to me, that has been the sort of one of the pivot points around the debate, that we started to move from the things that we could do to enhance safety, the safeties of communities and all of that sort of thing. And we started to flip to this focus on the prioritization of drivers and dealing with all of those terribly anti-motorist policies. And it's, I think it's one of the things that has changed the nature of the debate, as you say. Lucy, come in.
Yeah, and just to follow on from Ian's point, as a comms person, like, language is really important, and I think there's always a lot of focus on kind of the stats and whether we've gone up or we've gone down or all these kind of things. And what we try to do in when we're kind of communicating this out is the fact that it's not stats. It's, you know, it's 1,700 people's lives that have been killed. You know, it's that is what I think is the language comes out to kind of focus on drivers, where it focuses on stats. It doesn't talk about people, and that's what we try and do. So we try and talk about kind of how many people have been killed, but also how many people that affects. So, you know, families, communities, workplaces, you know, schools, all those things. We as you know, as Ian will know, we have many people that come to our charity who, 10, 15, 20 years ago, we supported them and they still want to come back and do things because it's still, still an everyday thing that they have to deal with, and they deal with it differently every single day. But I think that is the worry for me, is that the conversation moves out of talking about human life and talks about stats, and like they're celebrating a 6% decrease. It's not a decrease. It's more people have been killed because of this, lack of strategy being put in place. And again, you talk about kind of drivers and motorists and all that kind of language. But again, I drive, I ride a bike, I walk on the pavements, I fit all of those categories. You can't kind of pigeonhole me into those things. And I think sometimes that it almost becomes kind of pitching against each other, when actually we should just be talking broadly around making communities safer, making all road users be able to move around however they wish to safely. And that should be kind of the highest point that people should be talking about. But again, it isn't, because the language is shifted towards this kind of like, say, the best, safest roads in the world. Well, we haven't got the safest roads in the world, because we're not at Vision Zero. And until we have, we shouldn't be saying that. So, that's kind of, if you want to nerd out, I can nerd out on language a lot.
Great stuff. Thanks, Lucy. Thanks, Amy, for the post in the chat about war on the roads. And Ian Roberts, who I've met and know some of his work from London School of Hygiene and Tropical Medicine, he was talking about it in the negative context of the war on the roads, as far as I understand it, rather than this kind of political construct of the war on the motorist, i.e. the policies that are seen to be anti-driver. So there's more to explore there. So one of the policies that I'd be really interested in exploring is general safety regulation. So it's one of the things that finds itself in the PAC's manifesto. Effectively, we adopted, which is coming up to the anniversary of having adopted it across many states in Europe, but the UK has now fallen behind on having the highest standards for vehicle safety. So that language that we were just talking about, about having the best roads and having, being a world leader, we are identifiably now starting to lag other leading countries in that space. Anyone want to sort of address that and actually what a difference general safety regulation might make in terms of the safety performance here in the UK? Ruth, I've just noticed you've got your hand up. I don't know whether I missed that previously or whether you were coming in on this question.
It was a brief point on
Sure.
What Ian was saying, really, is he used the term language. I would have put in there also leadership. I think that's what's required. That's a whole nother webinar and debate, I guess. But I suppose I was thinking as Ian was talking and Lucy added to that, was about confidence. Why is this not getting traction? If we know that if something happens on the rail or an aeroplane, there's a huge dent in public confidence to use that choice of transport. And where do they go to? They go to the roads. And it's almost like we're neglecting the importance of the road network, whether it be rural or the strategic network, as a place of safety that the public should have confidence in. And I think we almost abuse that as the safety net, really. Maybe that's why it's not getting traction. But to come in, because I've spoken, to see if I can progress this point about safety. I do think that we're in danger. Again, I mentioned it before, of falling behind. Those safety issues were adopted by Europe when we were part of that network. It gives a lot of confidence. It's a benchmark. It's one that manufacturers and governments and citizens aspire to understand and work towards. And I have no doubt it does improve safety. As to why we are allowing this to happen in the United Kingdom, I fail to understand. I'm pleased that PACT are pushing on this. I will support it in any way. And through the Road Safety Trust, I find it scandalous that we are supporting grant applicants who are trying to bring about recommendations for safety for different types of equipment, helmets, etc., when that should be nationally driven to inform the citizen to make better choices. So I do think it's something that we should still keep on the agenda through our collective voice, because it's a very strong voice, and keep pushing for, really. I'm disappointed that road safety isn't in any manifesto, but that does mean and I know we won't give up, and I think these safety standards should be adopted and pursued.
Great, thanks, Ruth. Just to address Nicholas Evans's question, yes, we do have vehicles on sale in the UK that do not have an NCAP star rating. That's because the way that Euro NCAP works, that actually they prioritise rating the vehicles that are most common within certain markets. So you can get vehicles entering the market that meet the sort of minimum requirements, legislative and regulatory requirements of the market, but don't necessarily have a consumer rating like Euro NCAP. Rich, did you want to come back in on the vehicle safety piece?
Yeah, would do. So general safety regulations, I mean, it's a pretty boring title, isn't it? It'd be nice if we came up with something snappy that was easier for people to understand. So I did like the naming it Stop the Crash. That's the easier thing for us to remember. I mean, this is absolutely safe system 100% of the way through. You know, we recognize that humans make mistakes. You know, five or six decades of trying to make people better at driving by getting them to stop making mistakes hasn't worked, and we recognize that. So we need to look at the things that help us stop making those mistakes, or when we do make the mistakes, make sure that it doesn't kill somebody, including ourselves. And vehicle safety is one clear area where there is evidence. So evidence that's come from the UK, evidence that's come from TRL's extensive research into this, that showed that, you know, adopting general safety regulations across Europe, so that Europe that sadly we're not a part of anymore, is expected to save 25,000 lives, 25,000 lives and 140,000 serious injuries by 2038. Those are astonishing numbers. That's talking about preventing 30% of crashes from even happening. That's absolutely astonishing. I can't believe that this isn't something that we wouldn't want to do and that politicians wouldn't want to support. And I think it just stems around one tiny little piece of technology, which is around intelligent speed adaptation. And even the version of ISA within GSR is really weak. It's not about, you know, the totalitarian stopping you speed ever that Jeremy Clarkson et al. Will tell us is what it's going to be doing, but it's not. It's about giving us a nice gentle prod, warning, buzz, flashing light, noise, something like that that says you're going over the speed limit. You probably did notice. How about taking your foot off the accelerator? Wouldn't that be brilliant? I think just about all of us would agree that that'd be a great thing.
Are you going to have to pick a different target for the future? Jeremy Clarkson now, since Clarkson's Farm is becoming national treasure, so you know you're going to have to choose somebody else to take fire at. Ian obviously doesn't like that thought. Lucy, let me come to you.
Really.
No, I'm with Ian on that one. Just to say that we did some research last year with AXA, which said we asked people kind of like their feelings towards kind of vehicle technology and if they had it in their car and how they kind of, and just to kind of touch on why this was important, like over 40% of people that we surveyed said that they turned off the safety features that they'd paid for in their car. They turned them off, and when we asked them why they turn it off, the vast majority said that it was because they were annoying. So you know, that's something that we have to kind of look at as well. Then when we're out there campaigning for GSR to be introduced, a lot of, as you say, the things that come back to us is, you know, well, about the ISA, you know, what happens if I'm overtaking and a lorry comes towards me whilst I'm overtaking? How is that safe? And my response is always, well, why are you overtaking if there's a lorry coming towards you? You know, that's the kind of thing that we've got to kind of look at. But it is that, again, it comes back to repositioning them to each one of the regulations to show that actually how they can support people be not so much be better drivers, because people don't necessarily like to be told how to be better drivers, but just to support them to make their driving experience better. You know, it's that kind of, I think we have to kind of shift, because they're the kind of things that come back at us all the time when we're out there campaigning. It's about how it is there to help and support people, so it's easier for them, I think is kind of how we have to reposition it, instead of helping them become better drivers, even if that might be true for some people.
Yeah, it's really interesting. Back end of last year, I spent some time with some Volvo engineers out in Sweden, and they were talking about the degree to which those safety systems need to effectively be ringing true. And if they're not sort of right 7 or 8 times out of 10, then we will be inclined to switch them off. And so I think, there's a conversation to be had there with the vehicle manufacturers and some of the tier 1 suppliers. I mean, I know, there's some great work being done by companies like Bosch who are trying to bring some of this technology to the market, and they want to get it right because they want to get those systems to a point where they really are assisting the driver and they're not getting switched off. But we just need a little bit more maturity of some of those systems in the market. Liz.
Thanks, Dan. I just wanted to come in briefly on the GSR point. I think we need to be a little bit careful in assuming that no action to date means that there won't be any action or interest going forwards. We obviously all know since Brexit, there's been a huge governmental job in terms of transposing regulation, having to decide what priorities you go forwards with. So I suppose I feel reasonably hopeful that with whoever the incoming government is, that this could be a reasonable conversation about where this fits within the priorities. So I just think we need to be careful about assuming that there's no interest. It's just we know there's been a massive backlog of things to go through. And just to the point that Lucy made, yeah, absolutely, that point of education, of people actually understanding what the technology is. We're having reports of when people pick up their vehicle saying, oh, you don't need this, just turn it off, rather than actually, and we know that they have very limited time at that point of sale, but that's the opportunity in the moment where people are receptive to what's my new vehicle, what can it do, what can it not do, and we kind of need to do a lot better in getting into those right moments at the opportunity where people are receptive to kind of engage with them on that. So yeah, really important.
Yeah, great stuff, thanks. And Ian.
The other thing I wanted to add was in public policy and how agendas get set and how policies get picked up. You think about GSR as one example, or I would make another one, which would be road casualty targets from 2011. One of the things the literature says is that often you think that there is deliberate policy, there is deliberate decision making. There are, whether they are political viewpoints or this perspective or that perspective. Often all that's happening is events, is circumstance, is one of the civil servants I interviewed talked about why I was asking this person why the targets from 2010-11 were ditched. And the answer essentially, which was triangulated in a number of different sources, was basically, well, it just got wrapped up with everything else. We didn't really think about it, was kind of the answer. And I suspect that with the policy agenda over the last, certainly since the 2008-9 financial crash, that the political climate in terms of agenda setting and complexity and just sheer volume, and then there's lots of other things that we could add in terms of the caliber of some of our politicians over the last 15 years, which will be a personal view rather than what the literature is saying. I think rather than breed conspiracy or deliberate act, often it's just circumstance and the result of chaos within the political climate.
Yeah, thank you. And Rich, and then we're going to move on to a little bit more about the next sort of policy area.
Sure. Just a quickie to mention vehicle technology linked to post-collision response, which is eCall, something that was legislated in the EU and I think is massively underused, has a potential link to some of those high-profile young driver fatalities that we've seen as well. If more vehicles were fitted with eCall, people knew how to use them, emergency services had access to the data feeds as it came out, then that would enable them to get response really quickly to the scene. So, that's a vehicle technology that maybe more of us should be aware of.
Nice segue talking about young drivers, because one of the other asks in the manifesto is around graduated driver licensing, and I know this is something that both Ian and Liz in particular have done some work on. So we've danced around it for the last sort of 7 or 8 years. We kind of said, well, maybe we should do some more research on other things that might also be effective. And I think there has been an ambition to sort of explore how far we could take education initiatives. But Liz, I wonder whether I could come to you first, sort of say, where do you think we're at in terms of what the evidence is telling us, and why GDL might actually be the thing that we really need to grasp the nettle on?
Yeah, absolutely. I mean, I can talk about the more recent evidence. I'm sure Ian will talk about how we've been talking about this for more like 30 years, I think, rather than the last 10 or so. But
Try 40, Liz.
oh, 40, even
Yeah.
more. So I mean, all of us know that this is a big problem. We know that if we're to be smart about focusing on, we've had a lot of the big wins, haven't we, in road safety? There's things that we've put in place that have had massive differences, whether it be vehicle technology, dealing with drink driving, and actually assessing that. Obviously, we have changes and things are developing as we go forwards, but we now have to look at where are the small gains that we can get from these different areas. And we know that obviously young and novice drivers are overrepresented. They're only a small number of licence holders, but they're 24% of all killed and seriously injured collisions. And we know the circumstances where they find it difficult, that they have that inexperience, and they also have their issue around developmental stage they're at in terms of their age. So a lot of countries across the world have delivered graduated driver licensing in various different forms, including some sort of minimum learning period often beforehand, so sort of 12 months or some sort of set number of hours, and then having for that first 6 to 12 months afterwards some sort of graded ability to access the vehicle. So whether that be restrictions in the number of passengers or the time of travel that you can go. So often the night time with passengers, the social party car situation is essentially what lots of these initiatives have tried to address. So we have the evidence around the world, ourselves, TRL, many others over the years have repeated that work. We did some, or asked TRL to do some work at looking at what effect it would have in Great Britain. We've updated that over the years. We're looking at updating it again now, looking at recent data. And as you say, we have actually seen a reduction within this age group in terms of them as a prevalence. So actually GDL will achieve less now than it would have done in 2014. And again, we can say, well, what's that? Is that due to vehicle technology? Most recently, it's probably due to delayed access because of being able to get a test, the ongoing effects of COVID that are affecting that cohort. So we're potentially getting young drivers coming through that are just older, which we know will improve their safety as such. So it's something that's got a huge amount of evidence, and as Lucy mentions, it's been really interesting to see the difference in the response to the media. And I do think this has been largely because you have got many bereaved families that are coming together now to campaign collectively, that point that people have said before about that collective weight, and really demonstrating what we see in the statistics, which is these incidences are all happening in such predictable circumstances. You know, I think we all really don't want to look at the newspaper on Monday morning because we know that there's going to be a case over the weekend that's going to follow that exact criteria, which are real people, real families, and all of the effects on their communities. So it seems like things are kind of moving in a more positive direction in terms of taking it up. But I mean, I suppose the opportunity is there for an incoming government, somebody who's got a strong majority, who can take something that might be seen as not necessarily popular. And I think your point here, Ian, I'm sure you'll make about we shouldn't be calling these things restrictions. This is about supporting young people in the early stages of their solo driving career. And we also need to be alert to the fact that the cost of insurance is so high now. People are being driven off the road because they can't afford it in any case. A large proportion of that will be down to collision causation and the costs associated with that. So talking about other political parties' kind of manifestos, and sorry, I will stop and let Ian carry on shortly, but there is a focus on youth, I think, in quite a lot of the manifestos, and actually some of it does look, inverted commas, restrictive, interestingly, but there is also an interest in making sure they can access jobs, employment opportunities. We know this is a cohort that has had huge problems over COVID, and there is that interest in that. So I think whatever we put forward, it can't just be on a safety basis. We have to think about mobility as well, as how we kind of couch this going forwards.
Brilliant, thank you. Yeah, so Ian, obviously, you know, you've been at the vanguard of being amongst, you know, yourself, somebody who's experienced that bereavement, but also working with others who've been sort of advocating for this and trying to sort of change the nature of the debate. How do you think we could be or should be framing it as we go forward on this particular issue around GDL?
I think the framing point, Dan, is really, really very important. And there are, it's like an onion. There are many different layers to this, but given the time we've got this afternoon, if I just want to say something about the framing point. I do talk about other things, by the way, for those that haven't met me before. If we look at the Australian experience, which is probably, I think, the best case study that we can adopt in the UK, partly because there's lots of similarities with the cultures and the kind of the governance within Australia, but also partly they're published widely and they're very accessible as academics and lots of other people. And what they describe, there's a really good paper by a guy called Rhys Hinchcliffe, which I would encourage people who are interested in this space to read, and it had some co-authors as well. It was a combination, some of which was actually luck. It was just the stars aligning. But what they advocate is a combination of the evidence. You can't have evidence without the politics. So a lot of people talk about evidence-based policy making as the kind of the utopian, the kind of the single kind of bullet. It never happens like that. So you have to have the evidence with other things. So what they had in Australia was the evidence. There was a lot of lobbying. One of the things we don't yet have in the UK is the health system supporting us loudly enough. So that's one of the things I'm working on personally, and they're very reluctant for obvious reasons. But they had a lot of the health infrastructure in terms of lobbying. All the road safety people were there, and they fell across certain politicians who were interested. And then the media got on board. So if we look at what happened in Australia, I think, and I don't know whether I'm optimistic or just deluded, but I think we're now in a position where if we look at the Australian experience and we look at the public policy literature, we are in a much stronger place, as Liz has described. The evidence has been there for decades. We had graduated driving license in New Zealand in 1984, I believe, again from memory. And we talked about graduated driving licensing not by name in 1993 in this country in Parliament, which is where the 40 years comes from. So I think we're in a much stronger place. Kim Leadbeater, MP for Batley and Spen, that was very, very supportive from the politics point of view. Sadly, she got zero support from either her own party or the other parties within Parliament for whatever reason we don't need to explore today. But I'm hopeful that we can replicate some of that. I think we need to get the health fraternity much more on board to say there are 4,935 people hitting the health system every year. And it's not just the young driver. So I'll come back to the framing point, which I started off with. I think one of the tricks we're missing is when you read the inevitable Monday morning, as Liz describes in the media, often the language is, and I'm paraphrasing, I really don't mean to be offensive, but that silly young lad is kind of, and what often will happen if you think about the language and you think about the response that people have to the language, it's not accessible to people. So a lot of the response is, well, that will never happen to me, partly because I'm a lot older, partly because I've not got young people in my family, partly whatever reason in their own set of personal circumstances. But what we don't talk about is the 50% of people who are nothing to do with the young driver or their passenger. 28% it depends on the year you look at, 28% are dead young drivers, 22% are dead passengers, but 50% is the 6-year-old girl walking down the pavement going to a ballet lesson. It's the pregnant mum by the motorway waiting for vehicle recovery. And what we don't talk about enough, I think, is that 50%. And I believe, look, with my research, but also my own personal experience, and I talk to a lot of young people, if we talk to that piece much more strongly and much more convincingly, where we can connect that something quite abstract and distant from a lot of people, that will never happen to me type attitude, to, well, actually, all my daughter was doing was walking to a ballet class and she's now dead because a young driver driving at 120 miles an hour on drugs drove on the pavement. If we can connect a lot of that together, and I think that's what's been happening. We've got Forget Me Not Families Uniting, which a lot of people on the call will know about. More than 100 families now. The stories are so similar, it is really scary, which builds on the point that Liz has made. We know what to do, we know what the circumstances are, we know what the data tells us. So back to the point about framing, I think it's a lot for me, it's about language, it's about how we frame it, but it's absolutely about the politics. I can't speak for Kim, I'm seeing her in a couple of weeks' time, but I'm optimistic that people like Kim, if she gets elected, clearly there's always that caveat, will continue her own drive to do some of this. And I'm also talking to lots of parliamentary prospective candidates who are also in that same place, again, subject to them getting elected. So I'm sticking with optimism rather than delusion, and I really do think it's different this time around. And one last thing, we're doing some learning in the autumn from Australia, so hopefully we'll be able to launch or announce something when we've got a visiting professor from Australia coming to help us. So hopefully that will come off. And again, just to learn from Australia, which I think is really very, very important.
Great stuff. In a second, I want to come to a sort of last question about sort of other asks beyond what's in the manifesto. But Lucy, just give you the opportunity to come in here.
Yeah, it's just very briefly kind of touching on what Ian said as well about that kind of almost 5,000 people that are killed or seriously injured in a crash resulting from a young driver. And again, it comes back to that perspective of this young driver who is driving at, like who's on drink or drugs and driving at 120 miles an hour. It's like, it is always portrayed in that way, but there's a lot of people in the Forget Me Not family group where it's just inexperience. They're not driving. They're not actually breaking any laws. They're inexperienced, and the difficult road conditions actually create a crash and a scenario where other people die. And it's not just the occupants in the car. It's people outside the car. So that's why it's not about restrictions. It's about the safeguarding of people who are learning to drive, but also the other people on the roads as well. And that is something that's really hard to cut through because a lot of the media focuses on these like young lads piled into a car kind of rhetoric that comes out of it. We don't necessarily give the same level of media interest to those situations where inexperience just of those road conditions can kind of play a huge part in it, which is why it's so important that we have that kind of where people learn and experience in all the different conditions before they can really go out and carry people in those vehicles and those kind of things. So I think that's also important to put forward.
Right, really quickly, just Driver 2020, which I'm renaming Driver 2025 now. I think that there is a real opportunity when, assuming that gets published with the next government, let's hope it does, to say, well, actually there are other possibilities. I've not seen any of it, so I don't know what it's going to say. But actually, I suspect it will say the best evidence is still within GDL. So I think that's another opportunity to explore whether there are those optimists that can say other things could happen, but then take us back to GDL, assuming it's published, as I say.
Yeah, and I think there are people on this call who will hopefully be wanting to sort of ensure that research does see the light of day, and will be seeking to make sure that ministers are faithful with that research because it is important. I'm very aware that we've only got a couple of minutes left, and we've only talked about sort of the 4 issues in the Pact manifesto, and we haven't sort of strayed much further. I'd done a whole sort of look through some of the manifestos as others have to see what's emerging. We won't get the Labour manifesto until tomorrow, but there's an article in the Guardian today which intimates that there might be a road safety strategy promise coming in that. The Lib Dems talking about active travel and increasing bus patronage. Actually, some interesting stuff within the Conservative manifesto, where it does talk about cyclists and vulnerable road users, but still the lens is very much the kind of plan for drivers sort of rhetoric. So what I wanted to just finish with, and I'm only going to give you sort of 15 seconds each to talk about this, is outside of the things we've already discussed, what are some of the things that you would like to see being addressed in the next Parliament? So, Will, I'm going to come to you first.
Yeah, thanks. I think it picks up on something mentioned in the Conservative manifesto around this idea of an independent advocate for victims of major disasters. And it ties back into this whole theme of language, that major disasters are unusual and they affect the public emotionally because how they're reported. And these are stories that are much more persuasive than statistics. So I think it's really about the fact a road death is a major disaster for the families involved, but it goes under that public consciousness. So and the causes are predictable and preventable, probably unlike a lot of major disasters, which are almost by definition unique. and these repeated disasters are preventable, and the role of something like an RCIB would inform that advocacy to try and address those predictable causes that can be prevented.
Great, thanks, Will. Ruth, you're on mute, Ruth.
I'd like to see a new piece of legislation. I think there's far too many drivers who are tested for drink or drug driving, and because the slowdown in analysis, they're bailed and they're still on our roads. And that's basically allowing risks back on the roads, because these people will reoffend and reoffend. So what I would like to see is a unique piece of legislation that gives people, or the police and the courts, the power to influence whether somebody who we've got initial evidence of them being under the influence and over limits of drink and drug driving should be prevented from driving until that full analysis goes through. And the excuse that analysis is taking too long is a really sad indictment of where we've got to. So that's what I'd like to see.
Great, thanks. Liz.
I think I'd go back to something I said earlier on, which is really that sort of national level trusted research environment to bring together data sets so we can understand in much more detail what we should really be focusing on in what order. So yeah, I think that's my number one.
Great, thanks. Richard?
If we reduced the average speed of traffic by 3 miles an hour on our roads, we would save about 1/3 of the people being killed. That's it. So why don't we have a look at the appropriate speeds to be travelled on all of our roads?
Fantastic. We've hardly touched speed. So Lucy.
I mean, yeah, I'd agree with everything that's been said. Just to add something that's slightly different would be, so work-related road collisions are estimated to contribute about 1/3 of UK road deaths, and I think 1/5 of serious injuries. But there's no requirement of organisations to record any of the incidents or any near misses with health and safety executives. So that's something else that we would be calling for as well, because again, it goes back to the data sets. You know, if we know what's happening out there and we know how to kind of to prevent it, really.
Great, thanks. And finally, Ian.
Can I have all of the above, Dan, as well, please?
Of course you can.
I would want leadership, and I would want that to be much more visible and braver and louder. And I'm not talking about politicians. Oh, sorry, I'm not talking just about politicians. I think it's across the sector. My observation is people are a little bit too shy to shout loudly. So I think we need to talk about dead people. I think we need to talk about disabled people. And I think we need to have leadership that says that is not acceptable anymore.
Yeah, thank you. A great place to finish. And thank you all for your patience bearing with us. I mean, I'm assuming that the fact that almost everyone has stayed right to the end indicates how much you've appreciated the conversation that we've had this afternoon. I'm enormously appreciative to our panelists for giving their time, to Ian, to Will, to Ruth, to Lucy and to Liz. I trust you found it a very useful conversation to participate in, to get the data and also to look at what could be in the policy landscape moving forward and how we can make a strong call to a future government to make that a part of our collective lives together here in the UK. Look out for more content in the future, because there will be more in the pipeline, but for now, trust that you stay safe out there, and we look forward to seeing you all again very soon.